So once the couple walks in, counseling and a proper history taking is the most important thing that we do. Once we get to know what is the problem, we advise them the treatment options. Hello everyone, I'm Dr. Neha Gupta. I'm an infertility specialist and the director of Mediworld Fertility. Today we are going to talk about what is infertility. So if a couple comes to us and with 1 year of unprotected intercourse, if they do not have a pregnancy, then we call it as infertility. So infertility can be a primary infertility or a secondary infertility. Primary infertility means a couple has never conceived. Secondary infertility means there has been pregnancy earlier, but it has not led to a live birth, or even after a live birth, the couple is not able to conceive now. So for primary infertility, the couple has been trying for at least 1 year. For secondary infertility, if the couple is trying for 6 months with a history of previous pregnancy and they are not able to conceive now, we call it as secondary infertility. If we talk about what are the causes for infertility, so the male and female both are equally responsible for not being able to conceive. 50% of the times we see that it is the male factor infertility, where we feel that the male is absolutely healthy, there is no other problem, but the sperm count, morphology or motility, they are reduced, and because of which fertilization is not able to happen inside the body. Similarly, in females, there are multiple factors. The most common being tubes or the tubal factor, where the fallopian tubes are blocked. So there is no passage for the egg to come to the uterus, and the sperm and the egg are not able to meet and cause pregnancy. Secondly, there can be ovarian factors like PCOD, in which an egg is not able to produce spontaneously and the couple is not able to conceive. If we help them with some medicines or some injections for egg production, they normally conceive spontaneously. Now, the other factors like endometriosis, tuberculosis, repeated infections inside the tubes or inside the uterus, repeated terminations, multiple MTPs also damages the uterus lining, and the couple can land up with secondary infertility. So there are multiple factors where both male as well as the female can have multiple issues and they are not able to conceive spontaneously. Similarly, there are sexual factors like there is erectile dysfunction or severe dyspareunia in the female, where they are not able to have a normal sexual healthy relationship, because of which there is no pregnancy that is happening. So if the couple comes to us, we do a detailed history taking, we counsel them, we ask them in detail about all these factors. We do run a battery of tests and find out what is the cause. So what are the tests that are needed for a couple? If we talk about the tests, there are some 4 or 5 basic tests that we do for a couple who walks in with a history of infertility. The most common being a baseline ultrasound for the female to see how is her uterus, how are her ovaries, what is the egg reserve, how is the uterus lining, any fibroids, any other infections that we can rule out with the help of ultrasound. Then there are certain blood tests which can tell us about her baseline profile, like hormone test, her hemoglobin, sugar, thyroid, blood groups, viral markers. Similarly, for the male, we do these baseline blood tests and a baseline semen analysis. So semen test we recommend with 3 to 5 days of abstinence between a husband and wife. We tell them to come and do a semen test in the lab so that we can tell them what is the volume, what is the count, what is the motility and morphology of the sperms. Then another very important test is the tubal patency test. So which can be done with the help of an X-ray, which is called an HSG, or with the help of an ultrasound, which is SSG. In certain few cases where we feel that the couple should do a better test, we even recommend them laparoscopy. So laparoscopy is the gold standard to diagnose tubal factor infertility, wherein under short GA we put a scope inside, and with a keyhole we are able to see her genital organs and tell whether the tubes and the ovaries look healthy, whether the tubes are patent. We put a scope inside the uterus and find out what is the uterus lining, and if there is anything that we can help them out with, if there are any adhesions, any septum, any congenital defects that are minor, which are not picked up by routine ultrasounds, then those things are very well picked up with the help of laparoscopy. So once the couple walks in, counseling and a proper history taking is the most important thing that we do. Once we get to know what is the problem, we advise them the treatment options. So if we talk about the treatment options that we have for an infertile couple, we can help them with the help of simple medicines for egg growth. We can correct their hormone profile like their thyroid, their prolactin. If there is a low reserve, we help them understand what is her egg reserve with the help of an AMH test, and tell them in what time, what is the time frame where we are looking at, where we feel that they should be helped and taken the proper treatment that we advise. In couples where we feel that there are minor infections, we treat them with the help of antibiotics. In case of minor tubal blocks, we can help them with laparoscopies. In couples where we feel that other factors are fine, or there is a mild male factor, or there are mild endometriosis or unexplained infertility, where we are not able to tell you what is the cause, in those couples, we advise them to do an IUI. IUI is a very simple process. It is done in OPD. There is no side effect of an IUI. So we tell them to do a follicular monitoring. We find out what is the best day when the egg ruptures, and that day we take the husband's sperm, wash them, put media in it, make sure that the sperms are good and motile, and put them with the help of a small cannula inside their endometrial cavity, so that the egg and sperm are able to meet and cause pregnancy, and they are able to go through the pregnancy treatment easily. In couples where we feel that IUI is not going to help them, where both the tubes are damaged, where laparoscopy cannot help them, in those cases we recommend them IVF or test tube baby. Now IVF is also of two types, conventional or ICSI, which we are going to discuss. In special couples where there are certain couples who are walking in and saying that we have done multiple cycles of IUI and IVF, still we are not able to conceive, there are other options like surrogacy or adoption, where we help them to conceive. So surrogacy is a very, very good method by which we are able to help couples who have no uterus, or whose uterus is removed because of some surgical problem earlier, or who have had multiple implantation failures. In those couples, we can even do a surrogacy with their own gametes and help them conceive and be parents. So do not be scared. Infertility is something which is treatable. There are multiple options. Do not be scared to go to the doctor. Go and discuss your problem. We are there to help you out with full compassion and care. We will try to do our best and make your dream come true to be parents of a healthy baby. Thank you.